Hello, this is Dr. Vivek Vardhan Veerapaneni, a consultant pulmonologist from Swasa Hospital, Hyderabad. In this video, I'll be talking about diseases that are common in this rainy season. The monsoon is here, so with monsoon, we usually get a lot of colds, a lot of other diseases that are linked to mosquitoes. Cold can be because of allergy, when a person has dust allergy or allergy that increases whenever they're exposed to any kind of strong smells or smoke, or even with weather change, especially if they get wet in rain. So all this can happen to people who are allergic. So that can increase. There can be flu. Flu season is here. A lot of children may be suffering with some kind of cold. That can be contracted to adults and also to the elderly, which makes it more worse because they are at more risk of developing pneumonias because of this flu. So to prevent or to avoid this, it's better to get vaccinated with influenza vaccine and also pneumococcal vaccine as much as you can, whenever you can. Anybody who are more than 50 can get vaccinated with influenza vaccine and pneumococcal vaccine, especially if you have diabetes, if you have asthma, if you have COPD, or any other chronic diseases that are related to heart, lungs, kidney, or liver. Without any disease also, if you're more than 50 years, yes, you're a candidate for vaccination. So there can be asthma, there can be COPD. So when patients with asthma and COPD are exposed to the monsoon weather, they're at more risk of developing something called as exacerbations, that is asthma attacks or COPD or lung attacks, where they suffer with increased breathlessness, increased cough, wheezing, chest tightness, and a lot of phlegm production. If this is happening to you, that means you need to use your asthma-related medications or COPD medications and inhalers regularly. And if still it's not controlled, please consult a good pulmonologist so that what is a disease and what is the right treatment for that, what are the other things you need to follow to keep it under control will be told to you. There can also be infective lung diseases such as tuberculosis, that is TB, which is quite common in India, where a person experiences a lot of cough with or without sputum, can experience a lot of fever, and also weight loss and loss of appetite. If you're having all these symptoms, please don't take antibiotics by yourself. Don't go to pharmacy and get the medicines. Instead, go to a good pulmonologist so that they screen you what is the root cause for this problem, and you may get a diagnosis depending on that. It can be TB, and TB is curable. It can be cured in 6 months. However, there can be drug-resistant tuberculosis cases which may take a little longer time. There can be increase in cases of dengue, malaria, chikungunya, all these whenever there is this monsoon, because we see a lot of tires, plastic papers that are clogging the drains, and a lot of plastic bins that are left outside in the rain. So this leads to accumulation of this stagnant water where mosquitoes happily enjoy, and they produce many other mosquitoes, leading to increased cases of all these. Efforts from the government are important. They keep doing that. However, as a responsible citizen, you are also supposed to do all this. You are supposed to avoid any kind of littering of plastic, or avoid keeping empty utensils or plastic items outside the house where rainwater can be collected. So take care of your household premises, that if everybody does this, entire country is taken care of. So this has to be done. You have to use mosquito repellents, creams, or it can be net, or there are electric bats that can kill mosquitoes. So use all these, rely on these more than mosquito coils or jets, because they increase your airway diseases. So I recommend taking precautions first, and also use mosquito repellents on your skin, and you can use mosquito nets around your bed, or even to all the windows and doors. So this will bring down the mosquitoes. So these are all the diseases that are common during this monsoon season. So we just want to make sure everybody has knowledge about this, so we strongly believe at Swasa that prevention is better than cure. So we believe in public education, so that most of you may be taking precautions according to this video, and more information is also available at WHO website regarding all the topics that I've discussed. Take care of yourselves and also your near and dear. Share this video to spread more awareness and not disease. Thank you.